Let's begin with the second section of our lecture, Benign Tumors of the Larynx. We already discussed in detail about the solid non-neoplastic tumors of the larynx. And in this section now we will talk about two other conditions, which are the vocal nodules and vocal polyp, and how these two conditions they present and how we can treat these two conditions, vocal nodules and vocal polyps. Vocal nodules, also known as singers or the screamer's node. So these two conditions, people who sing or they scream a lot, in other words, who use their voice too much, vocal abuse, these nodules develop in those people. Here if you see, these are the normal vocal folds here, and that's the vocal folds with the nodules present. So vocal nodules or singers or screamers node. This usually appear symmetrically on free edge of the vocal cord. This is the free edge of the vocal cord, junction of anterior 1/3 and posterior 2/3. So the vocal nodules, they present or they are formed on the edges, free edges of the vocal cords at the junction of upper 1/3, anterior 1/3 and posterior 2/3. And people who are the singers and the screamers, they develop these vocal nodules. Due to vocal trauma, vocal abuse, what happens, people who do the vocal abuse, there is edema present, and edema we know is due to retention of the fluid or is due to accumulation of the fluid. That's the edema. Hemorrhage in submucosal space and hyalinization or fibrosis. So fibrosis and hyalinization occurs. There is edema and there is hemorrhage in submucosal space as a result of vocal abuse, and these different changes leads to the formation of vocal nodules or the singers or screamer nodes. So that's the vocal nodule as a result of the trauma caused by vocal abuse that leads to the formation of a node in the free edge of the vocal cord at the junction of anterior 1/3 with the posterior 2/3. The size of these nodes vary from that of a pinhead to half a pea. So very, very small, not big, really very small. Pinhead is a small size node, and then a little larger, half of the pea. Vocal nodules, the epithelium, what happens to the epithelium in the formation of the vocal nodules, it undergoes hyperplasia. There is increased growth of the cells, leads to hyperplasia. In early stages, nodules are soft and reddish in color. They are edematous, but in the later stage, nodules turn gray or white in color. So that's the difference between the two nodules that can be, if you see, soft and reddish edematous swelling, but as the time go in the later stage, it becomes the grayish or white. The two difference in the color of the nodules, if it's early or if it's in the late stage. So very important differentiating factor. If it develops early, it's reddish in color and it's softer, and with the time it becomes white. These are the whitish nodules here you can see. The symptoms associated with these nodules, vocal nodules, we have the hoarseness of the voice, vocal fatigue, tiredness of the voice, vocal fatigue, because these were the people who were abusing their voice. Now they won't be able to abuse and they feel very tired of talking, so they have vocal fatigue. Pain in the neck on prolonged phonation, on prolonged talking, they have pain in the neck. And edematous swelling. So all these are common symptoms associated with vocal nodules. Treatment of the nodules is early cases of vocal nodule. The treatment is conservative and educating the patient in the early stage. So the treatment, aggressive treatment is not recommended. A conservative treatment and educating the patient that this might be the problem and these are the symptoms which might be present. So that is recommended. Surgery for large nodules, nodules of long standing in adults, excised with precision using cold instrument or laser, avoiding trauma to vocal ligament. So initially in the beginning, the conservative management, symptomatic management, educating the patient is important. But as the nodules grow bigger and they become large, the symptoms associated with them becomes more promising, more prominent, more disturbing. Then we need to do the surgery, excise the nodules, and then also we should use the cold instrument or laser, avoiding trauma to vocal ligament. Speech therapy and re-education in voice production is always important. Next condition is vocal polyp. Polyps are the outgrowths or the projections of the mucosal lining which may be pedunculated, have a stalk attached to them, or sessile, no stalk. So very, very good picture of the polyps on the vocal cords. Due to vocal abuse or misuse, so same as the nodules, that's why these two conditions are the vocal nodules, you can say vocal nodules were in the singers or screamers. Same here, the vocal abuse leads to the formation of polyp also, but here the contributing factors are the allergy and smoking. Allergy, seasonal allergies leads to nasal polyps also because of the bagginess of the mucosal lining, hanging of the mucosal lining. They are more prone to form polyps, so allergies and smoking. Unilateral arising from same position as vocal nodule, so free edge of the cord at the junction of anterior 1/3, posterior 2/3, so the site of formation of the nodule and polyp is same. Soft, smooth, often pedunculated. Symptoms associated with polyps are the flop up and down glottis during respiration. So during the breathing, the epiglottis is flop up and down glottis. Hoarseness of the voice is a common symptom. Large polyp may cause dyspnea. Stridor is present, intermittent choking, and this diplophonia, double voice. Double voice like diplopia, double vision, diplophonia is double voice. But when the person speak, they have two voices coming out. The sound is produced is not equal. So two sounds are produced. Intermittent choking is present, stridor is present, and all these are symptoms associated with the vocal polyp. Treatment of the vocal polyp is due to sudden shouting causes hemorrhage in vocal cord, subsequent submucosal edema. Treatment is surgical excision under operating microscope. So polypectomy, as with polyp in any other area, is the surgical treatment of the removal of the polyp, polypectomy. So when there is a polyp present and the person usually have a shout, usually that polyp can lead to hemorrhage in the vocal cord, and there is edema in the vocal cords. Speech therapy is also recommended along with the surgical procedure. So that was all about the vocal nodules and vocal polyps. Thank you for watching sqadia.com.